The Latino Center for Health is the only research center focused on Latinos in Washington State and in the Northwest region.
We are the first center like this to be formed at the University of Washington and really in the state.
The Latino Center for Health is an interdisciplinary research center that was established with seed funds provided by the Dean of the Graduate School, Dave Eaton, as well as the Dean of the School of Social Work, Eddie Uhara, and additional funds were provided through the School of Medicine.
It's envisioned as a center that brings together academic and community interests through a partnership for the effort of making the health better and addressing the needs of Latino communities in our region.
We were launched in 2014 to conduct research to improve health and address health disparities of Latinos. We are very aware of the changing demographics in terms of the country's population. Latinos continue to grow in terms of number, and in Washington State, that's also replicated.
And the Latino population is predicted to grow even more rapidly, and we will have over 1 million by 2030.
One thing to think about is what makes the Latino community different from other communities and what are the unique needs. So we've tried to focus on those things that are related to the type of work, the type of health problems, the lack of access to care, the lack of appropriate providers.
And we wanted to begin to address those differences, those disparities, but to also improve health. Not just be reactive, but also promoting health, so changing health patterns and educating the population as well. We also recognize the scarcity of bilingual, bicultural providers, and we wanted to educate, train the next generation, not just of scholars, but of practitioners who can make a difference in the field so that the Latino community can be well served and enjoy health.
The goals, the ultimate goal of the Latino Center for Health is to have an impact on not just practices by the Latino community and by the service providers, but in policy. Work with the community members that are most affected by these policies to help drive and instigate change. So together with policy stakeholders, with researchers, with community serving institutions, and with the community themselves, we can actually create a Washington that provides better outcomes for the Latino population.
So this is a historic time in our state and in our region and really in our country in terms of the growth of the Latino community. This center represents the first significant step towards meeting the needs of this growing community, an important community in our area. We think that investments made now will have benefits in the future, because really what we're talking about is improving the health of an important and growing segment of our population, which we don't serve well now. So we know that Latinos are impacted by health disparities. We know that there are problems with providing high quality of care, and this center is about addressing those issues.
The Latino Center for Health was an aspiration. It was a dream that is being realized and actualized, and its impact continues to grow. And we're grateful for that opportunity. We're grateful for the support of the provost and the university. We have a wonderful new office space, a new executive director, and Leo and I as co-founders of the Latino Center for Health. It is exciting, it's powerful, and to be able to collaborate and impact the necessary change for all of us is just a tremendous privilege, and we look forward to continuing to grow and partner with the community.
Thank you for taking the time to listen and learn more about the Latino Center for Health, and we look forward to working with you in partnership in order to improve outcomes for the Latino population in Washington State.